Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair, just sticking out.
Hello!
Oh my God!
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'll do it again.
Events to be remembered and retold for generations to come.
Pandemic babies. Look at you.
COVID has really brought a lot of changes. People are coming into hospital. There's a lot of PPE gear. There's a lot of people obviously wearing masks. So the anxiety in that in itself really has an effect on the women. I actually really miss seeing grandparents coming in to see their grandkids. There's like balloons, there's flowers, presents, and they're so excited. And there's that like energy of happiness.
With the numbers of COVID cases fluctuating throughout the pandemic, the level of access to the Rotunda for birthing partners has been limited. Over the past 18 months, restrictions have increased and decreased depending on the level of the virus in the community. Tara has been 2 days in the hospital in early labour. COVID restrictions have allowed her husband Neil to be able to join her for 5.5 hours each day.
We're here. How are you?
Now that they have made it to the delivery room, he can remain with her until after the baby arrives.
We met through mutual friends at their housewarming party. My friend had married one of her friends and I answered the door to her and got drunk. A couple of hours later I asked her to marry me and we're here now.
I didn't say yes that night, but
I just knew that I wanted to marry her.
oh.
Lying. Is this a little boy or girl?
A little girl.
A little girl. And what do you have at home?
A little girl. Yeah.
Fantastic.
We make cute girls.
Oh, isn't that
They
great?
look like their daddy.
Don't they all? It's typical, isn't it?
Mother
All
Nature.
the hard work.
Yeah. That's us yesterday.
Oh, look at the... Oh my God, she's a special
Image.
Oh, look.
Sure, I love him, so why?
Yeah, well, that's it.
Half the battle.
These gorgeous girls. She'll be
Exactly.
spoiled rotten. So your little girl, what's her name?
Erin,
And who's minding her?
Granny and Grandad.
The love of your life. Your face just lit up. Oh, isn't that great?
She is my rainbow.
Oh, isn't that
She
lovely?
really is.
And my journey to motherhood has been not an easy one.
Been consistently pregnant for the last 4 years.
God, that can't have been easy. No, very tough.
No, but it was.
And you came in here. You were you treated in here?
Yeah, for all of them. So yeah, the first one was as bad as they get, but
We have experienced two very, very hard losses. One where I nearly did die. Unfortunately, our first attempt ended in a miscarriage, and unfortunately complications led to me hemorrhaging quite badly and I nearly died.
as I told one of the registrars who came to see me on my second natural miscarriage, I said, I'm going to keep trying until you send me home with a baby.
Became pregnant again for a third time, and again it was a different experience. We didn't really exhale for the first 9 weeks until we heard a heartbeat. I quite quickly said I was going to enjoy that pregnancy for as long as it lasted, and fortunately,
They went well.
yes. And Erin, our rainbow baby, came in and brightened our entire world.
Yeah, we're so lucky. We're so lucky. Counting my blessings in every possible way.
Watching her thrive has only helped us blossom
God, it can't have been easy during COVID to be
No,
working from home.
we went from straight in and minding a 1-year-old, and then by the time lockdown 3 happened, trying to coordinate a toddler, it was just a completely different experience because like we had a period of creche in between, and we got so used to it, and that's part of the reason why I'm pregnant.
When the creches reopened, we made sure that we had husband and wife time. Okay, if we can't go out for dinners and we can't have date nights and we can't have holidays, how can we have us time? And you know, he would always make dinner and I would be dessert.
We enjoyed our lunch breaks together.
Oh dear, yeah.
Pandemic babies.
Well, the proof in the pudding is in the dilatation, because so if she's dilating, she's progressing.
Yeah.
You know?
Boston native Ryan is expecting her first baby. She met her partner Patrick just months after arriving from the United States in 2019.
We met on Bumble, and we probably talked for about a week, and then we went on a date, and we just had such a great time. We were together for about 6 months, I'd say, and then COVID happened, and so we went from seeing each other like 2 or 3 times a week to then being with each other all the time.
There was a real high pressure situation, so you learn a lot about people quite quickly. You know, everybody can do it when it's going easy, but you face that little bit of kind of adversity, if you like, bump in the road type thing, and you kind of see what a person's really about. And that was the start of the pandemic, and here we are 15 months later.
7 months after being together in a COVID cocoon, Ryan became pregnant.
It was probably a few days after we found out. I had a little bit of bleeding,
Yes.
and I was really freaked out. And I ended up going to the early pregnancy unit in the Rotunda. So it was my first time going to the Rotunda. We're pregnant for the first time, and I was like, oh my gosh, I feel like something bad's happening because like you're not supposed to be bleeding. And it was really scary because I had to obviously go in without him. So he was waiting in the car, so that was not nice.
Ryan has a genetic heart condition, which makes her pregnancy high risk. She is now 36 weeks pregnant and sees consultant Jen Donnelly every week.
I have hypertrophic cardiomyopathy with arrhythmias. So basically, it's a genetic condition where the walls of my heart get thicker, so my heart gets really stiff and it has a hard time beating. On top of it having a hard time beating, or beating erratically sometimes. So I ended up getting a pacemaker put in, or ICD put in, when I was 20, I believe, because I kept fainting. It will actually shock me in the way that you would get, paddled. You see it on TV. So that happens inside my chest, which wouldn't be great for me or baby.
So the spine there, so actually the spine is on this side. So you have the lips, the nose, the little fingers. We know that people with hypertrophic cardiomyopathy are at increased risk of developing a complication such as an abnormal heart rhythm or heart failure, sudden death, and other cardiac symptoms such as shortness of breath. And that these during pregnancy can change, particularly around the time of the 3rd trimester and around delivery.
Oh, fantastic. A little 2-page medical history.
So that's brilliant. So what we're going to do have here...
I didn't have any bad rhythms or anything after my surgery until I got pregnant. The readings where it showed that I was coming close to having like a heart attack.
How have you been feeling since last week?
In the last week, having a couple of palpitations that made me a little bit lightheaded, and I'm just not sure if it's because I just have extra weight on me.
And how long are they lasting for? Would you say seconds?
Yeah, it's definitely seconds.
And how many times? Like every day?
No, I've probably had it like in the last week, maybe twice.
Twice, okay. So, but more frequently. That's more frequently than before,
Yeah.
isn't it? Yeah. Well, I think because you're seeing cardiologists again next Friday.
Yes.
Right? Yeah. So, I mean, I guess if it was more sustained or if it was happening every day, then come in and we can just give them a call to get them to review things. But okay.
There is a scoring system that's used called the Maternal WHO Risk Assessment Scoring System, and that's a scoring system that goes from 1, which is similar risk to someone without a cardiac condition, to 4, which is someone who would be advised against pregnancy or that they would be at very high risk of complications. Going into the pregnancy, Ryan's risk would have been assessed between 2 and 3, so kind of mid-range. We try and mitigate those risks, but it's never possible to totally predict
Well, I mean, it was always just a part of our relationship. It was something that had happened in Ryan's past, and from a day-to-day perspective, it's just taking medication. And I think, she takes it in stride. So for me to make it in any way a big deal or a barrier or anything like that would be quite selfish. So I just adopted the approach she took.
Yeah.
It's just part of us, I guess.
Sore.
Tara is hoping to go through labour and to give birth without any pain medication. She knew from an early age that an epidural wouldn't be on her birth plan.
You getting a little bit uncomfortable?
Yeah, it's fast though. It's fine. I breathe through it.
I had a curvature in my spine, diagnosed when I was 7, and I was operated on when I was 11. So I knew from a very young age that I would never be able to have an epidural.
Yeah, and just gas and air just made me woozy. So
Did it? Okay.
I just
You're just going to
like
breathe.
Yeah. That's what I said. If you do nothing else, just remind me to exhale. I
Don't worry,
tend to.
Neil and I standing there, making sure that you're breathing.
It's like breathe out, Tara.
So I knew if I ever was to become a mother, there would have to be different options. And I always, as I got older, particularly I always wanted to be as strong and as fit and as healthy for when we were ready to have a family, to be able to deliver those babies as naturally as possible and experience my children coming into the world.
But no pain. Yeah, we just get on with it, don't we?
Yeah.
Us women.
Yeah.
Sorry, Neil, it's not just women. I'm sure some men are great with
Do you know any?
You're so mean. Yeah.
Neil wouldn't swap with me, would you?
I think we'd be in trouble if the men were having the babies. Yeah.
Spent a lot of time over the last few years challenged with various things between my miscarriages and losing faith in my body's ability to bring life into the world. But particularly after having Erin, she made me feel like a superhero and that there was nothing I wasn't capable of doing.
Have you a name for this little one yet?
We do.
Yeah.
Am I sharing yet?
Oh, no,
waiting?
no, wait, absolutely wait.
The
until
big surprise.
She's born.
Yeah.
Lovely. But you easily agreed on it, did you?
Yeah, it was easy because he's very fussy, Terry.
So I have 3 rules for naming babies. The first was the name had to be Irish. The second was it had to be 2 syllables. And then the third was that you had to be able to spell it. So you're going for Orla, as it's only 4 letters. And even an American can pronounce it.
No lap dance.
No. I'll leave you to it.
Could I be sexier?
Although he's a man of very few words, when he talks, he's very, very solid and makes me stop and think.
This one's gonna make us work hard, I think.
And you truly, truly bring me the most happiness.
They're all delivered, yeah. So it'll just take a little while. We'll get there. Grant, we'll do them one at a time. Lovely. All right, honey.
Patrick and his partner Ryan have arrived to the hospital for a scheduled C-section to deliver their baby. The last few weeks of the pregnancy have put Ryan's heart condition and her pacemaker to the test.
I think the extra blood in my body probably put more strain on my heart. I came really close to having my machine go off a few times because one of the chambers is beating really fast and that can put you into cardiac arrest, so it's been crazy.
While in theatre, for safety, Ryan's pacemaker will need to be turned off. The anaesthetic team will take over the monitoring of Ryan's heart.
The ICD is set at a particular rate that it will give a shock to the heart once an abnormal rhythm is detected. And so during an elective caesarean section, we usually turn off this in order to avoid an inappropriate shock.
It wouldn't probably be good for them to have the internal one on and them all get shocked.
Not with a scalpel around a newborn baby. Probably not a good idea to get 10,000 volts up the back.
It's like a parade.
After I will let you see. Yeah, okay, and wait when we were ready.
Right, that's great.
Thank you so much. I'll see you in a minute.
All right, see you in a minute. I didn't feel any anxiety until I woke up this morning. Me personally, when I'm nervous about something, I can feel it in my stomach, almost like it's dropping out kind of thing, like I'm on a roller coaster, you know, at the top of it, about to go over.
If something does happen, they told me that they do have a plan where I would go to the Mater hospital, and then I think baby would probably just go home with you.
Probably, yeah.
But hopefully nothing like that happens.
Yeah. So there's no pain, but you can feel like the tugging.
Oh, your chest, are you okay?
It's just a lot of pressure. Remember I had those wires on it?
Oh, yeah. Okay.
That's definitely.
Squeeze the hands and have to.
Cases.
Is it normal for her?
Yeah, this is normal.
Okay.
More for the head, liver.
Really?
Yeah. Congratulations.
It's great. I threw up at the beginning, but much better now. And it's just such a relief.
Thank you. Oh, nice.
Lovely size.
Yes.
It's just under 7'5". Oh, the little hat. So cute. Oh, I'm sure he's dying to meet his mummy.
Over the next few days and weeks, Ryan's condition will be carefully monitored as her heart and pacemaker slowly adapt to her no longer being pregnant. Patrick has already begun to adapt to being a new daddy to baby Killian.
What's going on, little guy?
You're doing great. He looks very happy there in your arms.
Yeah, as long as he's not crying, I'm happy out.
And he'll have to get used to a bit of crying.
I think so, yeah. Oh, we want some food. Hello. Now what do we do? We squeeze the bottle or just let it go? Oh, he's sucking it.
He'll just suck away. So.
You're sucking away.
Well done.
Thank you.
So there's a 50-50% chance that the baby will have the gene. So the thing is that you can have the gene but not have any symptoms, and they don't know how it's going to develop. It develops differently in everyone.
I'm happy?
Yes.
Yeah.
How are you feeling?
I feel so much better.
Congratulations.
Monitoring is really the most important thing. So we were hoping to get him tested.
Quite early on,
Yeah.
yeah, absolutely.
Oh, he's kicking me.
Yeah. It will just be something that in the background, and we may have to deal with in the future, but just to be kind of aware of. And I don't think knowing us that we'd be able to live with not knowing. To be honest with you, you know, some more than others.
Oh, big yawn.
This is my time of being a mommy. Oh, come on, give me your
Okay, no, I'm taking her out.
Tara has been 3.5 hours in the delivery suite without any pain relief. Things are now moving more quickly.
She went from not doing a whole lot to 8 centimetres. She had her first little daughter within 2 hours, and then she bled quite seriously afterwards, and she needed a blood transfusion because of the blood loss.
Memories of Tara's previous delivery are still fresh in Neil's mind.
That jumped like 44. I was worried. The thing that scared me the most was with Erin the first time round, she ended up having difficulty towards the end, it was kind of important to keep an eye on her heart rate, because that's what I vividly remember from the first pregnancy, was when her heart rate dropped, and that's when the whole team came in and started rushing around.
That's just picking up mum's pulse, so don't panic.
Oh God, I really feel like I'm pushed.
Yeah.
Where are you?
Tara, I'm going to maybe just very gently examine you and see what's happening, okay? Good girl. Do you feel that pressure now again?
Yeah.
That's it, lift that leg up, put that hand behind your knee. Wonderful, good girl, just like that. Oh, she's just sitting here, beautiful. Well, you're 10 centimetres, Tara, so you're able to just go for it. Just a couple of really good pushes, Tara, with all that pressure, and you'll have her out.
Okay.
Okay. I suspected that this was a bigger baby than her first baby, and she's quite small in stature. That can just make you think, okay, is she going to be able to deliver this baby easily? Could there be a problem? You're okay. You're all right. I know that pressure is getting huge. Good girl.
I work for the catering department, so dealing with the food, the best part for the patients. That's actually amazing how you see this tired face, and then all of a sudden the spark in their eyes when they see us coming with the tea and toast. They're like, oh my God, I've been waiting for it. Every morning when we prepare the breakfast and we smell that tea and toast, we're like, why can we not have that? But no, you have to wait for your break.
So you're going to hold on to both legs this time. Good girl, is it starting again? Yeah.
Tara's baby is close to being born. However, the baby's progress through the birth canal has stalled.
She was pushing for quite a while, the baby wasn't moving. And on a second time, Mum, you expect that the baby will progress a little bit quicker. She's sitting there waiting for a couple of good pushes. That's it, Tara, long, steady push now. The head was just sitting there for longer than I was happy with, and I will always call for help. Good girl. Hi. Come on in. Big push. Good girl. Go for it. A little bit of a prolonged acceleration, kind of slow advancement to the head. Good girl. Come on. That's it. Fantastic. Well done. I know that pressure is absolutely huge.
Tara, what we might do is just pop you around on your back and get your legs up just to make a little bit of space, just to see if we can get the baby's head to move a little bit more. Is that okay? Yeah. Well, I just
That's
give
it.
you
Good
a
girl.
little
Try and wiggle yourself into
Well
the
done.
middle. You're brilliant.
No, I'm just going to pop you down there. Has it been sat there for a while, Terry?
It's been actually all right, just the last kind of 2 minutes. Another big push again. Tara, chin on the chest and right down into the bottom. So advancement of the head in the second stage. You're kind of thinking, is there maybe a problem with the shoulders? You get me there, though? Yeah, very tight. Yeah. Tara, I'm going to do a little episiotomy, just baby, but it is still, yeah, absolutely, yeah. It's not something that we routinely do. It's only if a baby is in distress. That's it, Tara. You tell us when you feel that now. Okay, the contraction.
It's just that point, that millisecond of you're exhausted.
Okay, is it starting?
Yes.
Okay, good girl. So a big push down into the bottom.
It's that fight or flight moment that you really do want to give up, but you have to remember that your mind is not in control of this, your body is, and your baby is.
That's it. Big push, yeah. Great. Oh, well done.
Honey.
Well done.
Toss the head.
Big push, chin on the chest. Good girl. Well done. That's it. Good girl. Oh my goodness. Oh, she's just lovely. Now we take this off. Well done. That's all we wanted to hear. Look at that. Well done.
Well done.
There's just such a wave of relief that washes over you, and euphoria, bliss. I was like, thank God everything went well.
Welcome to the world, Miss Orla.
What's her name?
Orla.
Lovely. Gorgeous. How are you going to spell Orla?
O-R-L-A. Yeah.
Keep it simple.
Yes.
Sorry.
We're all about keeping things
Rule
short
free.
and
Yeah.
Actually, it is.
Sorry, I forgot that, yeah.
To be able to spell it.
I'm so sorry.
We did it. I was very, very grateful to have my beautiful baby girl, just getting to know her and holding on to her and not having that dreaded feeling that I was going to lose another little person.
Get them buttered before they go cold. You know me and my hot toast.
Even through the hard times, you can survive them and you can grow from them and you can help others by sharing those losses. Talk about it and know that it's temporary. You will be okay. The sun will come up tomorrow.
Toast never tastes as good.
Everyone always says that.
The little things are the big things. If the pandemic hasn't taught us that, nothing ever will. You holding on to that boob?
This has been a very different and obviously very challenging year because of the pandemic, more than a year now. This has really restricted a parent's access to spend time with baby, and that is always an issue for us because we think that contact is so critical. I can only imagine how hard that has been for parents. We're really grateful the parents helped get us through this, and we're just delighted that we're able to welcome them back more and more.
For the first 9 months of the pandemic, access for parents to NICU was severely restricted. For Sarah's 8 weeks here, 1 year into the pandemic, she's been allowed to visit for up to 6 hours per day.
But they weren't allowed to touch.
Sarah works as a midwife in the Rotunda. She was just under 27 weeks pregnant when she went into early labour.
I was at home and I started getting a few pains. There was just something in me that was like, you have to go into the hospital. But I remember just on the way in thinking, these 26 weeks and 5 days, I've had 2 babies in ICU already, this can't be happening again. It was literally the second I hit the hospital, the pain started coming every 3 minutes and you could just see the contractions bouncing up and down.
Both of Sarah's older boys were born premature. She was hoping against the odds that Aiden would reach full term.
I went from 0 to 10 centimetres within about 15 minutes. When that all started to happen, Aiden's heart rate started dipping and dipping and dipping. I needed to have an emergency section straight away.
Before Sarah went to theatre, she phoned her husband Cliff to come and join her in the hospital.
From the time that the bleep went out to him being born was 6 minutes. My husband was able to come in and take photos of Aiden while I was asleep. When I woke up in the recovery room, it was still a very surreal experience. And then obviously Cliff had to leave straight away. My husband, he wasn't allowed to go to the ward with me afterwards, so I went up to the ward on my own. I had no baby. I had no kind of knowledge really of what was happening because I was so out of it. And then I didn't get to see Aiden for another 8 hours or so. So it was a very surreal experience to be lying in a bed with no baby, no husband.
Aiden has been cared for in the neonatal intensive care unit for the past 8 weeks.
Hello. Hi, Bubba. Oh, it's okay. It's okay.
I was very naive going into ICU. I thought, oh, he's just going in there for prematurity. He just needs to stay in an incubator for 3 months, and that's the only problem. Whereas he had to be intubated, so he had to have a tube down his throat because his lungs were so bad. He had an issue with his heart due to prematurity. We were faced with bam, bam, bam of like, this is what's wrong, this is what's wrong. It's such an eye-opener.
Well, Aiden was born at 26 weeks and 5 days. He's over 13 weeks early and has effectively missed a third of his time in mum's womb. He needed to be instantly supported with his breathing. Aiden then went on to develop much longer-term chronic lung problems. And that happens for babies like Aiden when an immature lung has to breathe for itself and when we need to help them too. But it's very much an intensive care because so many parts of the baby's body need support.
I will always carry that guilt that he is here because of me. You can't help but feel my body failed him and this is my fault.
Sarah has been expressing milk every day for Aiden for the past 8 weeks. Her husband Cliff can visit too, but not at the same time, and is limited to 1 hour a day.
Trying to keep it together while he's in ICU, it's a very big juggling act because the good days are amazing that you think like there is light and we'll fully come back from this. But then there's the bad days that you're just watching your little baby in an incubator suffering and you can't hold them and you can't touch them because they're so weak and they're heartbreaking. Even today, Aiden's had a little setback with his breathing and I think it's because when you have such a good run, you want to keep running towards that exit. So it can be a very frustrating and disappointing place to be. You're getting all this information constantly. They can progress or they can decline so rapidly that you're constantly getting updates and constantly being told information. And it's very hard to retain because your mind is such a muddle. Your imagination is always the worst.
Can I just get your name again?
Neve.
Yeah,
that's
perfect.
Okay.
Yeah.
Don't worry, ask me again if you need.
In the delivery suite, Aleni is in early labour with her first baby. Recent scans suggested that her baby was measuring quite large.
Yeah. What size did they say he was going to be the last time?
I think they were saying like between 3 kilos and 500 grams and 3 and 800.
Yeah. I thought it was going to be like really high up.
Yeah.
It feels okay. Like, you know, like I can feel that his head is there, you
I
know?
can't feel that.
Yeah. Are you a bit nervous?
No, I'm okay at the moment.
Yeah.
Relaxed, yeah.
Yeah.
But I have the history, like the genetic, because I was born when my mom was only 8 months pregnant and I was like over 4 kilos.
Oh, really?
Yeah.
And do you have brothers and sisters?
No, I'm only child.
Oh, okay.
I think she
So you
got
don't know
traumatized.
She was like, never again.
Never again.
Alena came to live in Ireland 6 years ago from Brazil. Just a few weeks later, she met her husband Carl. Now that she's in the delivery room, COVID visiting restrictions don't apply and he can stay with her until after the baby arrives.
Hi, how are you? I'm Neve. Nice to meet you.
Hi.
How are you?
Thank you. Good. You're looking great.
Yeah.
It was a long, drawn-out chase. Yeah. Aleni was looking for English lessons on Plenty of Fish, and I was an English teacher at the time, so I thought this is my chance to shine. And it took me ages to get a first date, and I got one playing Jenga, but she didn't say a word to me. She was like flanked by 2 male Brazilian friends.
I asked these 2 male friends to come with me because I didn't know what would be the outcome of that date.
Really great chat.
Yeah, so it actually was good because we were there like as friends, and so I think took a bit of the pressure of like first date.
Where will I
You can leave that over. Maybe, Carl, if you can get some baby clothes out.
Baby clothes, yeah.
He made me to fall in love with him, going slowly and respecting my time. So then I think after a few months that switched a little bit in my mind. They're like, oh, maybe I don't want to keep as a friend anymore. And I saw the way...
Got out of the friend zone. I didn't know I was in the friend zone.
It's getting real now, huh?
Yeah, this is beginning of my training.
That's it, yeah. You'll be a pro now in a week's time, don't worry.
Well, Aleni's labelled everything for me here already, so...
I know.
Grand.
Just in case. After a few years enjoying our marriage, we start thinking about, oh, maybe we should have a kid, or then think about...
A dog.
Oh, yeah, dog
First,
first. Yeah, dog came first.
This is not That's Brazilian baby clothes.
Yeah.
While still considering getting a dog, Aleni surprised Carl with some news.
I was away at work, and then when I came home, there was like a pair of little Converse shoes on the bed. I was like, that's not my size. And, what's going on?
Yeah.
How are you feeling?
Good. That is a bit of discomfort, but like good.
Then it dawned on me, you know, she's pregnant. You're relaxed.
I am, yeah.
Your jaw relaxed.
Yeah.
My role as a clinical informatics pharmacist would be entirely through the computers. The cyber attack completely took down our capacity. I remember walking in the door of the pharmacy, immediately hearing my phone buzz, and when I checked the message, it was Brian telling me about a ransomware attack. It was kind of a dissatisfied exhalation, and then everyone just inhaled and got on with it. Drag out the paper and start going again.
In the delivery suite, Aleni is still in early labour. The medical team are concerned that the baby might be lying in an awkward position for delivery.
She had large for gestational age, which basically meant that her baby was growing greater than the 95th centile. So for first-time mums, this can be a challenge. In Aleni's case, we wanted to decide, is this baby deliverable vaginally? We're going to examine you again like we did on the ward, and then we'll break the waters. We're going to use the ultrasound just to make sure there's no cord there. So the baby's head is just a tiny bit, what we call it, like bobbing away, so we don't want anything to get in between that when we break the waters. Ideally then you want the top of the baby's head coming down the birth canal. We want to see what's the presenting part. Is it a bum? Is it a head? Is it a face or an ear? The hand.
Oh God.
Just by the head. Sometimes the hand can come up by the head.
Like he's relaxing.
Yeah. He's saying, go away. We realised that the baby's head was quite high in the pelvis, which meant that if we were to break the waters on the ward, there was a risk of a cord coming down and it wouldn't be the ideal place for that to happen. So what we do in that case is what we call a controlled ARM, or a controlled artificial rupture of the membranes.
Well done. Yeah.
And the idea is that we put pressure on the top of the tummy and break the waters in a very controlled manner, and we put a lot of pressure down so the head comes into that space.
Sorry.
You're doing great, Bubs. Keep calm.
You're great. Just take deep breaths in.
When they tried to change his position, this was extremely painful.
I was a bit worried there was something wrong or something. But seeing Aleni, like, I expected her to be nervous. And then I saw her and she was grand.
Too many of them.
And that made me more relaxed then when I saw that.
Yeah.
Keep breathing.
Doing amazing.
Keep breathing.
Having him beside me, remind me to breathe, was really important, was like crucial actually.
Oh my God.
Oh.
What a relief.
Huh?
That was so much pressure.
Relax all your body now.
Okay now. He's not a messer, isn't he? He's
troublesome like his mother.
Yeah, yeah.
He's a messer, like.
He's already disobeying his parents anyway.
Yeah.
Yeah. Reminds me of someone.
People who work in the hospital also use the hospital. People start their professional training in the hospital, and they grow up in the hospital, and eventually they might have their own children within the hospital. So you view the hospital in a different light when your children have been born there. So we've felt the highs that the people who come through the Rotunda have felt. We've felt lows that they feel at times, unfortunately, when things don't go well. So we try and provide the care that we expect for our family, for our children.
Sarah's baby Aiden was born extremely premature. For the last 3 months, he's been fighting for his life in the neonatal ICU.
When you have a child in the ICU, you're walking around all the time with this huge amount of stress, and you don't even realise, because you have to carry on. You have to get dressed in the morning, you have to deal with everyday life, you have to come in and be strong. You might have a step forward as in, oh, that hole in his heart is getting smaller. But then now his stomach is bleeding because it has an ulcer now because of that medication. So we just need to fix this one and then we can turn to that because look, this one is getting better, this one will get better too.
Aiden.
You have to remember, this baby was born at 26 weeks.
Oh, big yawn.
Look at everything that he's done.
Hi, baby.
You think of how far he's come.
Look at you.
And I think we're getting there at the moment. Now we get to see his face properly.
Hello.
Aiden is now feeding well and breathing on his own. Sarah is excited at the prospect of finally bringing him home.
But he looks fantastic. He just looks like a bigger baby. He doesn't look as preemie or anything. He looks really, he just looks so grown up.
Yeah, it's 11 weeks now today, so.
Very busy 3 months, isn't it?
Yeah.
Well, happy birthday for your 11th Mark. You'll be deeply disappointed that people stop celebrating the weeks after a while. They go, look.
He's made huge progress. He's made massive milestones. So I'm hopeful that he'll be home by his due date.
But look, we peel back the layers a little bit, but just the next thing is that monitor gone.
Yeah.
You know. There's a little way to go for him. He, unlike many premature babies, has managed to wean off oxygen, but it took him a long time to do so. Chronic lung disease is something that we always are concerned about, although most babies will manage it very well. There's still a path ahead, but we would be very optimistic that with time, he's going to get there.
Yeah.
Are you dying to get him?
Yeah, we are, and meet the 2 other boys and things like that, so we'll be.
Oh, they'll be thrilled as well.
Yeah, they will. They'll be all over you.
Yeah,
All over you.
it'll be lots of love.
Yeah, lots of.
It's great.
So.
Look at you. I think you played it blinder. You did fantastic.
Sarah is looking forward to using her experience in the NICU to help other parents when she returns to work.
Being pregnant or being a new mom can be the loneliest thing in the world. So to have someone who understands and can comprehend what you're feeling is probably the best support system that you can have because you're not alone. I know what it's like and I know it on a personal level now, so hopefully I'll be able to do that for someone. I'm sure with the amount of things that have happened to me, I'm sure there'll be someone I'll be able to help out, but yeah, it'll be brilliant to be able to do that when I get back, yeah.
Aleni and Carl's baby is lying in an awkward position, which could make it challenging for a vaginal birth.
So yeah, start taking the gas, okay? So start breathing in, keep breathing all the way through.
Consultant obstetrician Nicola Marr has been called to advise on the safest way for the baby to be delivered.
Unfortunately, your baby has got its head turned, okay?
Yeah.
Sometimes during labour we may feel baby's hand in front of the face, or we may feel that baby's forehead or brow is the first presenting part. And when we explained to Aleni that her baby was facing face first as such, she was very understanding of this, and we explained that the safest way to deliver her baby would be by caesarean section.
Yeah, that's okay, yeah, no problem. Okay. When they said, oh, he's not going to change his position, let's go for a C-section, I was really happy, yeah, let's go, because he's definitely not going to change, and this has been quite painful. And I just want my baby to be delivered in a healthy way and be safe with us.
It's good, isn't it?
Yeah, it's good. It's the best.
Sometimes they just have other plans, huh?
Yeah.
Hi.
You're a brave old soldier.
God, he's troublesome, isn't he?
Troublesome.
Off you go, yeah, go on ahead. Nope. Thank you very much. Now, so it's just in here, Aleni. Just in there.
Here?
Yeah, I'm just in there before.
all of a sudden I was on my own and just left thinking to myself that I was about to become a dad. That little interlude was pretty intense.
Just a little drape coming over you now, okay?
You look great, you're glowing again.
Am I?
Yeah.
And light alright? Stay in the middle now, you're good.
When they brought it in for the C-section, I was pretty nervous inside.
Yeah, it's going very well.
It's not okay still, thank you.
Sure, yeah. Oh, yes.
Pressure and stretching now for a second.
Yeah? I feel like pressure.
Yeah.
Like moving, but they're not there now. It's all good.
Oh, hello, baby. What do we have? Big boy. Yeah, onto your one shoulder. Yeah, there you go. Yeah. Big boy.
When I saw him for the first time, of course, I just felt like completely in love, and I just thought, oh, he's amazing, such a perfect baby.
So he's 8'8".
He looks like you.
Just check him over, okay?
Well done, little man.
I know.
That was tough. Oh, that was tough.
Congratulations. You did so well. Beautiful baby.
Oh. He's great.
Yeah, not bother, and we'll see you now in a few minutes, okay?
I had him there, and I felt like I was in a bubble of this intense kind of experience. Everyone else is like a regular day, and for me it's it's something I remember for the rest of my life. Finish now.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair just sticking out.
Hello!
Oh my God!
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'd do it again.
Events to be remembered and retold for generations to come.
Pandemic babies. Look at you.
The patient's experience during COVID has been extremely difficult. If your partner is going through something very difficult and you cannot be there to support her, it is very, very upsetting. I've had to do some counselling on loudspeaker, on the telephone. It's just to allow somebody to even have a second person listening to what I'm saying. It's very unnatural not to be able to sometimes even give somebody a hug. Even this elbow thing, that's just doesn't do it for me or for the patients.
It's 4:30 a.m. and first-time mum Michaela and her partner Mark have arrived at the Rotunda with the first signs of contractions.
The girl at reception was like, I'm so sorry, I have to kick you out. I was like, oh, it's okay. And then I went outside. I seen like there were full row cars outside the Rotunda where, people sleeping in them.
Waiting for the call.
Waiting for the call to come back in. So I did the same thing, followed suit, hopped in the car and tried to go to sleep, but like it was getting like 5:30 stage, the sun was starting to come up. I think he called me and I said, I'll just go home.
Mark had to wait until 4 p.m. to be back by Michaela's side. 4 hours later, it's time to leave again.
He had to leave at 8 o'clock. That's when visiting hours were over.
Be brave.
He went all the way back to Baytown. At 10 o'clock, I got to the 3 centimetres. So I call him on the phone. I say, hey, I'm the 3 centimetres, come back in.
Yeah.
And he goes, are you serious? I just closed my eyes. I was like, oh, I'm sorry, this timing's not good for you. Do you want me to hold this baby in until you get your rest? So he's like, all right, I'll come back in. I was like, yeah, better come back in. Don't give me that attitude, you know what I'm saying? I feel happy.
It's 11 p.m. Michaela's contractions are now regular and strong. While gas is helping, she has requested an epidural.
I was just wondering when the epidural's going to be here.
No, in 2 minutes.
Okay, good.
Anyway, that's good that she's laughing.
Yeah.
Are you okay?
Like crying.
That's it, there you are.
I'm 26.
And I'm 21.
We're together 3.5 years now.
Yeah.
Oh, holy moly, this is hard.
Well, we met online.
Yeah, on POF. I swiped right, so it was love at first swipe, you know what I'm saying?
We're winning. It's like, oh God. Almost from the get-go, like we both wanted children. I wanted to wait till I was around now. And Michaela said she always wanted to have children early.
Young, yeah.
Be a young mummy.
Yeah.
And
Yummy mummy.
yeah.
And what are you having?
A boy.
A little bit maybe. And what do you have a name for him yet?
It's gonna be Elliot.
Elliot, a lovely name. Great name. Elliot from
E.T.
Phone
Phone Home, yeah.
Lovely.
Hopefully he's not gonna be slagged and be like Elliot, you know, at school. So. I was 19 when we bought our house. It's a lot different to like my mates at this stage because they would be clubbing and partying and we did buy a house like when I was still a teen, you know.
What time is it anyway? Almost 3 o'clock.
3 o'clock. You didn't miss out on much as well, having
Yeah.
being pregnant during COVID because everywhere was shut. You weren't being envious of your friends going out or anything like that, you know?
Seeing photos on Instagram like of the girls going out or having drinks, or I never got that jealousy, you know, because no one could do it. So I was like, oh, this is great because we're all suffering together, so why not do it now, you know?
So shaken.
Yeah, I know. It comes and goes. I don't know.
Your contractions are nice and regular. They're regular and they're strong.
Good.
You can do this, and you are doing it.
Yeah.
Youth helps.
Yeah.
You're young, which is good. There's no athletes running on the pitch at 50 odd years of age, you know.
Youth may be on her side, but during Michaela's pregnancy, her age wasn't always taken in a positive light.
Being 21, being pregnant, I have had like a few questions, feeling judgment because I am young, like was it planned? So sometimes it can be hurtful because people could think that like he's a mistake when he's not a mistake. Like
It obviously helps. The body's more flexible.
Yeah.
And then the older you get wiser in the brain, but stiffer in the joints. And you think,
it was our first month trying, and we were pregnant, you know. So yeah, I'm a fertile thing. I am. My eggs are good.
you have youth on your side, and you've got brains to burn.
Thank
You've got
you.
everything. Unlike me. I'm getting things beginning to seize up. That's all ahead of you.
Yeah.
Would you be like,
Do you want to do the abs there?
I've done it.
Oh my God, you're a star. Did you go through all these?
I did.
Oh my God, where was I? Was I gone for that long? You're very good. Thanks. So it's really important, Patricia, that you always speak about reduced fetal movements, PV loss or pain. Is that all right?
And then go to the emergencies.
Yeah, I know you know this stuff, but I just... You can tell me to shut up silently in your head. Don't tell me.
Shut up.
Yeah, stop talking.
Just 4 weeks ago, Joyce left Nigeria in difficult circumstances. She was 29 weeks pregnant with her much-wanted first child.
I'm 36. I've been married for some time. I've always prayed to have children. Finally, my prayers has been answered. When I was 8 weeks, we went for scan. They said there is baby there. They say heartbeat. That was the last scan I went for in Nigeria.
When Joyce arrived in Ireland, she was accepted into direct provision. Shortly afterwards, she had her first scan in the Rotunda.
Last month, I was having pains. I couldn't move. So they brought me to emergency. The doctor scanned.
The scan revealed that there was more than one heartbeat.
When I scanned in Nigeria, it was 1. Now you're telling me 3. So I was never knew that it's going to be, my dream is going to come true. And it's coming with a surprise that I was thinking that it's 1 at the end of the day. I'm having 3.
Now 34 weeks pregnant, Joyce's triplets will be delivered in theatre today. She is in Ireland without any family and has been unable to speak with or see her husband since early in the pregnancy.
I do get scared because nobody around me. I still wish maybe I can see my husband.
It must be really scary arriving in a foreign country with no partner and no friends or family or no support, and then having 3 babies.
I'll sit with you, okay?
She's better company than most people.
Still smiling anyway, that's a good sign, isn't it?
It is a very, very nerve-wracking experience for anyone, I suppose, coming to a theatre department. Like, she just looked at me and I told her everything was going to be okay, and she held my hand, but when she looked at me, she was like, she was putting all her trust in me.
I have to be strong for this baby. It's not that I'm going for an operation because of my heart or anything. I'm going to bring out life.
Little bit. With 3 small babies, and they were all premature as well. We never know until we actually go in and open up the uterus what way the babies are coming. We only knew that there was 1 boy and 1 girl, and then 1 unknown.
For the shoulder trying to come out.
Wow.
Really.
The first little boy came out head first. That was easy peasy.
Little lips trying to come out here. Okay, there we go. There we go. Wow, look at you.
Hello. And number one is a boy. There's your first little man. He is. He's perfect. Oh. So do you have any names for them, Joyce?
Yes.
What are you going to call them? But they were all going to begin with the same letter, weren't they, I think?
The first one
Yeah?
is Abby.
Abby. Lovely. There's a head over there. And then this other head is kind of here.
Then it was a little bit tricky trying to feel around to see was baby B or C coming next.
Don't just grab that foot.
Yeah.
Cool. Got a hand.
I kept finding a hand and I didn't know whose hand it was. I was trying to kind of push that back out of the way and see if I could either find a little head or a little bum or a foot. You just have to sort of take your time and not panic.
I think I have the other foot here, right? Yeah, brilliant.
Like now, I've known that one is boy, one is girl. I'm still hoping, I believe that the other one is boy too. Because you have two boys and a girl. I would want those two boys to protect their sister.
Wow, look at you.
And it's another little boy.
Aww. Aren't you perfect? Oh, okay. So now what do we got now?
Then the second one is Asha.
Asha?
One more to
So then there was just one remaining baby left inside, so that's much easier to be able to feel around and see if we can find another little foot to be able to grab the foot and guide the baby out.
Wow. Hello, happy birthday.
Lady.
This was a girl.
And what's the little girl's name?
Abigail.
Abigail, that's so cute. All A's, yeah.
Third one is Daisy, princess.
Princess. She will be a princess, won't she? Definitely.
Tiny, tiny. Ah, great. Thank you.
Where's my girl? Oh, she's coming. The princess is arriving. They'll make her entrance. Oh, is this her? Oh, look at her. Little tinge. Adam. She's gorgeous. This was a massive thing for this lady. I mean, she was just so calm, so grateful at being a mom for the first time to 3 babies. Such an amazing woman.
My babies are here.
They're so here, aren't they?
Are you in any pain?
No, not right now, no.
No. Good, good.
Yeah.
Epidural's working okay.
Yeah.
Right.
Numbs half her body.
Michaela's labour is progressing very well, and with an epidural on board, she can't even feel her contractions.
I think something's coming out me. I don't know.
I always imagine when your waters pop, it's just one gush and that's it. More came out and I was like, oh my God, like, did I just wet myself?
I don't know if something's happening. I just feel like something's coming out.
Okay. Well, we better check that out.
Yeah. Can your waters?
Yeah. Oh, yeah. They
just
certainly
keep
can.
going?
They certainly can.
Feels so weird.
Why are you starting to drop the... Oh my God.
I know.
Oh my God.
Yeah. You have the River Liffey down there.
I know. They just didn't stop coming out. I was like, what is going on with me?
Give me a moment.
Is it really bad, man?
Yeah. Called in another midwife.
No.
Hi.
No stream like the...
For help?
You're like Anna Livia lying there. The floozy in the jacuzzi.
Yeah.
Do you remember her?
No.
You don't remember? You must. You of course. You see, you're young. Anna Livia. Actually, Annie Livia was like you in the bed there, except she was in O'Connell Street.
Okay.
She represented the River Liffey. You were representing the River Liffey here.
Oh my God. Like it literally won't stop.
Ladies think that when their waters go, that is just it, that they won't continue to come. It can come as quite a surprise that sometimes there's quite an amount of water they didn't expect, a lot more than they expect. Yeah, oh my goodness. Yeah, God, well, there you go. Water, water everywhere.
Not a drop to drink.
Yeah, well, I wouldn't be drinking that.
He was gas, like he was so funny. It made the atmosphere in the room really positive.
I seem to be getting that pressure again.
Right, you know what? I'm thinking we're nearly time to examine.
Okay.
Something telling me you've advanced.
There's a waterfall going on.
Yeah, well, you know what? I don't need convincing now.
I'm
You've really
nervous.
efficiently moved along.
Yeah, I'm nervous to know now.
Good. Huh?
I'm nervous.
You're wondering what if you're not fully?
No, I'm nervous that I will be.
Take a deep breath. Hold a deep breath. Push my fingers away. Just push down. Oh, you're gonna have no problem. You're gonna have no problem. Oh, but,
Am I
okay.
fully?
You're fully.
Oh.
It means the cervix is gone. The cervix has got out of the way.
Okay.
I've just examined.
Hello.
Hi.
Fully dilated.
Oh my God, well done.
I know.
That's great.
Yeah.
Very good.
Flying
Oh, you're flying.
Yeah.
That's
So
very good.
start pushing in an hour.
Joyce is recovering after the delivery of her triplets. She faces an uncertain future for now in direct provision without her husband or her family to support her.
Okay, the long-awaited triplet has finally arrived. Yes, seeing my children today, the sadness subside from me. At least I know that I'm no longer alone in this place. My children is with me. My family is with me because they are my family. I would like to hold them in my arms, the three of them together. I would like to hold them, to feel them.
The babies will be cared for in the neonatal intensive care unit until they grow stronger and reach their due date.
They are breathing on their own. They don't need any kind of respiratory support, which is amazing.
While in hospital, recovering from surgery, Joyce will have unrestricted access to her 3 babies.
The first boy. And Abby.
Oh my God, that's so cute.
It's good because it's every woman's wish to be a mother. Yeah, as a woman that brought me this world, I'm happy bringing children to this world because it's very, very good.
This is Asha.
You know, that word mother is something that I have to get used to till they grow up. My angel. Abby girl. So, and my dream is for them to have a good life. Princess. I want the world to know them because of their doings. Very much excited. I couldn't even sleep. I tried to sleep, but I was eager to come and see them. My plans, I'm staying here. I've come to like this place because it's peaceful. Daddy loves you too. Lovely, overwhelming, happy, and I feel great. Being a mother of 3 is very, very good and interesting. I love you so much. I love you guys so very much.
Time for Shawnee to get an apron on. Are you ready to rock anyway?
I'm ready.
In as much as you'll be, yeah.
Nervous but ready.
It's 4:50 a.m. After 7 hours of active labour, it's time for Michaela and Mark to get ready to see their first child, Elliot.
Now, this is like being in the ringside with Katie Taylor. That's your job. Mop the brow. Keep it going.
John just kept cracking jokes like.
You look after that end. You do heads and I'll do tails, okay?
Kept going, kept the spirits up.
Yeah. Big deep breath, big push. Here comes baby already. Here comes Bambino.
Squeeze your hands as hard as you want.
Very good.
It's hurting.
The biggest challenge was when I was pushing him out.
Okay, you're doing fine.
I found that absolutely exhausting because I just was so drained.
You're doing brilliant.
I can't do it.
I felt like, is he ever going to come?
Come on, give us one more because it is still there.
Wow, he's nearly there. He's coming.
Him being calm me down. Like I feel if he was anxious or he was stressed, I'd feel that and then I'd start like freaking out.
Sitting there now.
Big hairy head in him.
Yeah,
he does.
This is it.
See, look, little ginger.
And then you just chin down, give your all. That was a big one. That was a good one.
Hello, baby.
Oh wow, baby, he's coming.
Give us a push.
Once the head came out, he
The body
just flew out, you know.
Yeah.
My goodness.
5 past.
Oh my goodness, baby.
Hello.
Oh my god, baby.
Happy birthday, baby. 25 past 5 in the morning. Up she goes, over she goes.
Oh my god, baby.
Oh God, when I first saw him, the screams out of him, like, that's the loudest baby scream I've ever heard.
Got that lungs on him.
I heard all the other babies crying, they were like, "Ah, ah," and then Elliot was like, "Ah!" He looks like me! Oh, you're so cute! Megan did a good job! You're a dad, Mark.
That's what I was lost for words when he first popped out, you know, he's like, you brought this
Yeah, you
little
just saw
person into the
awe.
world and you're like, oh my god, like, I have to look after you for the next
Yeah.
rest of my
I've
life sort of
designed
thing, you
stuff
know?
for you.
Thanks.
You won't get better days than this.
You can't describe just the instant love and affection you show for him. I don't know, it's just so natural.
Good.
Yeah.
Oh, you look glossy
Well,
Don't be riding the man up.
it's bound to happen, isn't it?
He's, you couldn't help but be proud.
He's such a little tongue. I'd do it again.
His little tongue. Could have 2, could have 4, you know, could have 6. You never know, or could just stay at 1, you know? What?
6. Not a chance.
I might joke. But you never know. He's beautiful, isn't he?
You're smitten.
Of course I am. Look at him. He looks just like me.
Together. Well, that's it together.
It's 9:20 p.m. and Rose and Slavy have arrived at the hospital just in the nick of time. Less than 3 hours ago, Rose was walking around their neighbourhood in Kildare, hoping she could bring on her first contractions.
I went for a walk with my mom. We walked for 6K and then I went back home at a little bit past 6 in the evening. And at 7 I started feeling some contractions. Suddenly something happened and from 8 minutes they started on 3 minutes. And this is when I told him, okay, we have to go.
Hello, I'm Ruth. Nice to meet you. Where are you?
This is the couple's third baby, so as soon as the contractions started, Rose knew that they needed to get to the hospital as fast as possible.
I didn't break the speed limit. No.
No, because our car is not fast enough to break the limit. What? Yeah.
We were in a rush.
Well, wait for that to go, all right? Well done.
I was just came to decision if there's guard on the road and they start chasing us, I won't stop. I'm just gonna drive. I might open the window and shout at them. We're going to Rotunda. Follow us or guide us.
Do you want to start getting out the baby stuff for me? And if you just pop it on the warmer there.
I still remember the lights on the keys. It was green, it was yellow or orange. So I had to make a decision, will I go? But I knew she will be, yeah, she will be not happy. I did.
He went and my waters broke.
And yeah, that happened.
So he helped me.
And she was like, are you crazy? Are you crazy? What are you doing? We have to get their life.
And your waters just went at 9 o'clock. And you're 5, so you're doing good stuff. Sorry? You're doing good stuff.
That's our experience, driving from Kildare to Dublin for the labour.
Just on time. We went just on time.
Are you having a boy or a girl? Girl. A girl, lovely. What do you have at home?
We have 1 girl and 1 boy already.
Okay, so the boy's outnumbered now.
This is special one.
Rose and Slavy met while working together in Bulgaria.
We met on the ski resorts in Bulgaria, 2010.
No, 2009.
2009. I had my eye on her because obviously I liked her look, how she looks. I was a little bit shy actually to go and talk to her first. I won her attention, but I know she's not single at the time, so I just sat and waited.
Is that okay?
Yeah.
And then a kiss. I remember that I initiated that kiss, but if you ask him, he initiated the kiss, so it depends who you ask me. It was me. We were celebrating our 10 years wedding anniversary. That was at the end of August. And then in September, we were surprised after the celebration that, we have a present for our 10 years anniversary.
Did you have quick deliveries on the other two?
Yeah.
Yeah.
Especially the second one.
Well, that was even quicker. Hopefully the same again.
There's such a cultural piece about acceptance of epidural analgesia in labour. So I've done some work in Malawi in the third world, and the midwifery staff there spent their time laughing at me because they couldn't believe that my job was to provide pain relief for women in labour. It was just beyond their comprehension. But yet in some countries around the world, the epidural rates are almost 100%. You do see patients who are absolutely against an epidural until they labour and then change their mind. And then, of course, you see patients who are adamant that they want an epidural, and sometimes they deliver too quickly to have their epidural. So it's not perfect all the time, but we do try and treat patients very individually to help them get through their labour and delivery.
Hi, Nana. Oh, hi, Nana. Sonny, hello, Sonny. Hello.
Jenny is in the hospital today for her 20-week scan, accompanied by her mum, her husband and their only child, Sonny. Before Sonny was born, Jenny and her husband suffered the loss of 5 babies through miscarriage.
The first one was nearly 7 years ago. We found out that I miscarried at 12 weeks. We were told by one of the midwives, straightforward, you don't really drink, you don't smoke, it's going to be an easy pregnancy. I remember they were doing the scan and it was just like a black hole. It was like the ground opened up. We had to go down and get bloods for my HCG levels, and you were sitting in between all these pregnant women beside you, side by side with you, and you were just totally grief-stricken. You don't know how you took one step in front of the other. And it was just devastating. It was within 6 months then I got pregnant again, and we found out that I miscarried at 9 weeks. And then I had 3rd, 4th and 5th miscarriages between 6 and 8 weeks. And they were all kind of 6 to 8 months apart.
When you see patients coming back in subsequent pregnancies, having suffered from miscarriage, even one miscarriage before, you can see the stress and the anxiety when they come in for the scan. And this stress and anxiety doesn't disappear until they hear the heartbeat. In Jenny's case, even I was anxious whenever I was seeing her name on the list when she was coming in for early scan, because you're rooting for your patients. You want them to have a healthy pregnancy. You don't want complications, and you don't want to give them bad news.
We've been in scans before. I think it was the 3rd miscarriage I had, and I had bleed, and we went into hospital. They scanned me, and it was the baby's heartbeat, but it was really slow. And I remember somebody gave out to me that I needed to stop being so anxious. And I remember I literally sat in the car and I started to bleed, and yeah, I suppose the baby was dying at that stage. And part of you knew.
1 in every 5 pregnancies ends in miscarriage, but it's extremely rare to lose 5 babies in a row. Although heartbroken, Jenny and her husband Scott were determined to not give up hope.
We had loads of bloods done, really invasive procedures. We had things that make you feel really uncomfortable and that you kind of question yourself, are we doing the right thing? You have a limit, you have a breaking point. And unless you've walked in those shoes and you've come out of the clinic or you've come out of the hospital knowing that your baby has died, you've no understanding. When I got pregnant down on the 6th pregnancy, I said, if this isn't a success, I have to draw the line. And then kind of after the 20-week scan, you became really hopeful that we were going to have a baby.
Jenny's 6th pregnancy continued to full term, and Sonny was born 18 months ago.
And then when he was born, it was just the best thing ever. He's brilliant, like. And it just felt like everything was possible then. Because it was kind of against the odds, you know, so it was just brilliant having him because you felt the world was brighter.
Now 20 weeks pregnant, Jenny is relieved to have passed the point where she previously miscarried. As part of her treatment, she has to inject blood-thinning medication under her skin, causing bruising. For today's scan, Jenny is allowed to have her husband Scott with her.
20-week scan, from a medical point of view, it's always really important to know that the baby is okay, that all the organs are okay. It's hugely reassuring, and I suppose from COVID, it's the only scan that Scott can go into as well. So, like, you feel that I understand the restrictions, but that he's missed out on he would have been in every doctor's appointment before, even when I wasn't pregnant.
Lips the baby's nose. So there's the nostrils. Oh my God. There's the lips, top lip, bottom lip, and the chin. So your baby's lips are...
You're holding your breath until you hear that heartbeat, you know, and it's the one thing that you really want to hear. And when we hear the big thud of the heartbeat, you just know that the baby's okay, you know, and everything is okay.
I'd be happy whether it's a boy or a girl once baby is okay. And they're happy, that's all that matters really. Once baby is fine. Yeah.
So you do want me to check the gender, do you? Yeah. Last chance to change your mind? Yeah. Okay. I hope your baby shows me now. Come on, baby. Come on. Could you uncross your legs for me there, Jennifer, and bend your knees up and lift your bum off the bed and give me a little wiggle? Sometimes this helps shift baby right. Okay. And rest those legs down again. Let's see. Come on. Yep. It's just knowing that it's okay, the baby's okay. Jennifer, we're just coming to the end of the scan here. I'm really happy with everything I'm seeing here. I can't see any physical defects with your baby, and I can't see any markers that would suggest a chromosomal problem. Right. So everything here is very, very reassuring. It means it's very unlikely there's going to be anything. Right.
Here's Mammy. Here's Mammy. If it was a girl, Mammy would be delighted, but if it's a boy, she'll be delighted too. Is it a girl? It's a boy. Another boy. Huh? A little baby's perfect, thank God, and a little brother for Sonny. So delighted. Delighted.
Like me, myself, I didn't get it until I had a miscarriage. And I think that unless people have experienced loss, stillborn babies or miscarriages, I don't think anybody has any understanding in how devastating it is.
The restrictions had a big impact on parents. Knowing that your child was in the neonatal intensive care, especially if they were premature, not being able to see them as often as they wanted, has a huge toll on parents. We have seen cases, not in the Rotunda hospital, but from other centres, whereby premature infants getting a COVID infection meant that they became extremely unwell. They struggle with their breathing. They become very difficult to ventilate, and their heart can also suffer. We had to balance the risk of infection spreading in our unit with the fact that the babies need their primary carers, which are their parents.
That's it. Well done.
Rose and Slavy are hoping for the safe arrival of their third child. It's less than 2.5 hours since Rose's first contraction.
I had very straightforward births, my first two, and I didn't take any pain relief. With the first one, it took me 9 hours from the first contraction to deliver, and with the second, it was just 4 hours.
I have a push. You feel like pushing?
Yeah.
That's good, isn't it? That's what we want.
Rose is as cool as a cucumber, but obviously could just tell by her demeanour that the birth was probably going to be imminent.
Well done. You're okay. Do whatever you feel, okay?
I'm so sorry.
No, you're doing really well.
Oh. She wasn't afraid at all. She just let her body do everything.
Isn't it early?
I'd say, I don't think you're 5 anymore. But your body's giving me all the signs that you're progressing very quickly. So just do whatever you feel. So I think she's come right down because her heart rate's dropped a little bit. So if it doesn't go back up, we might see if it start pushing at the next contraction.
Okay. When you have a contraction, it's just like 1 minute where everything, it's so painful, but you know that it's just a minute, and when the contraction is over, you feel so relieved that finally it's over, and you can relax for 2-3 minutes until the next one.
I was there for support, but there was nothing I can do. I was just sitting there, and I was like, okay, you're doing well. Yeah, you're okay. I was also worried about it because I knew what she has to go through. I asked myself if anything happened. You know, everything could happen. So I was nervous.
Feeling somewhat helpless, this is a very different experience for Slavi compared to the birth of their first child.
I knew it's going to happen quick, judging by the previous two. Our first daughter was born in Bulgaria. The system there is completely different than here. Fathers are not allowed. You're only allowed to see your child after a certain period of time.
After 3 days.
After 3 days. And here in Rotunda, I was so excited and nervous. The experience was amazing. Kind of being there with her.
It's just emotional. It's really different. And it helps.
Just going to get 20 minutes of this, and then we can take it off. I think the baby will be born before the 20 minutes.
Yeah, I think so.
So it's a race.
It was such a huge approach. Yeah. It's coming again now.
It's coming again, don't be afraid. If you feel like pushing, that's okay.
Trying a bit of
Maybe
race
we might
to
get a bit 6 at a time then. Maybe.
Huh?
6 at a time.
Ash will go. So I move them along to you then, yeah?
Yeah.
Many hands and all that.
Exactly.
And too many cooks.
And what did your last slave die of?
Disobedience. Think on.
Oh, well done. Baby's head is just there.
Rose and Slavi had a hasty journey this evening to make it to the Rotunda for Rose's labour. Just 23 minutes after arriving, their baby is almost here.
We didn't even talk too much with the midwife, but we kind of understood each other with the sight. Okay, I'm ready, come here. And she came, I pushed once.
That's it, and the head is out. 21:39, well done.
I remember she was saying, oh, the head is out.
The head is out.
And we were like, oh wow, is this happening?
The head's just going to turn now. If you open out that leg a bit, well done.
And then she pushed once.
Won't be long. For the body, you'll push.
And then she pushed twice, and that was it.
Oh, I think she's coming already. You can give a push if the contraction's still there. Well done. Look at you. Okay. And she's a girl. Yeah, didn't even have a tongue.
That was super quick.
Oh, she's a nice size, isn't she?
Yes.
You're a good chunk, aren't you? Oh, well done.
Hello.
You're amazing. Very quick. Baby came out very rapidly. Well done. Get rid of that wet one. You're some woman. Just in, had a baby. I had a bit of a warning, but I didn't think it was going to quite be that quick.
You feel relieved and excited. For me, it's just laugh.
She turned pink within a few seconds, didn't she? She's very good.
Yeah.
I love her so much. She was so chubby, so pink. She was just perfect. And she's big. I was so happy to see that the baby is big, actually.
Do you want to do some skin to skin? Put her in under your top?
Yeah. The bond, for me, is very important. Waiting for that moment so they can say, you want to do the skin to skin, because I was waiting for that so I can hold my child.
She's very quiet with you.
Yeah, I think she's nice.
Yeah.
For me, being there was, it was wild.
Не ви държахме много в напрежение. Старахме се по-бързично. Добре, че Слави кара бързо.
So pretty. For Bulgaria, it's very unlikely to have 3 children. Like you have 1, and if you're lucky, you have 2, but no one's thinking about 3.
Having a tree, you're considered
A hero.
yes.
While at a checkup in the hospital today, Jenny began to feel contractions, and so she has been admitted.
I went in for my review with Dr. Cushell, and when we came around the corner to come into the hospital, I felt I was getting contractions. So I kind of sat it out in the waiting room, and when I went in to see him, I just said to him, I think I'm in labour.
How are you? Is the pain sort of getting worse, you think?
Yeah, it's quite intense.
I'm
feeling really nauseous as well.
Okay. So do you think it's a little bit different from like the discomfort that you were getting before?
Yeah, it's kind of, the pains are kind of going down further. Yeah.
So do you think it's...
I feel it's imminent. I feel it's
getting
it's only a matter of time.
Okay. You know, I'll discuss with Thea and see whether we can get a time to bring you in and deliver the baby past cesarean section and do it in the next couple of hours, you know.
Okay.
When you have a patient like Jennifer, where I've known her for a couple of years and I've seen how devastated she was with, bad news, it goes beyond doctor and patient relationship. It becomes someone you know and someone that you want to help. There's 39 weeks or 40 weeks of pregnancy, and until that baby is delivered healthily, you're not sort of completely relaxed.
Okay, well, gonna meet baby now soon. It's exciting. Sonny will be a big brother. It's a bit daunting. Yeah.
Jenny's baby is about to be delivered in theatre by elective C-section. Having previously suffered 5 miscarriages, it's been an anxious 9 months for herself and her husband.
The fear, it never leaves you at all until you're holding that baby in your arms. It's something that I never take for granted, ever, ever. I can't wait to see it. Right.
Each one get pushed in the air.
So can you feel any of that, Jenny?
A little bit.
Okay, but nothing sharp, no?
No.
Okay.
It was just kind of overwhelming, that we were going to have a family. It just felt like the possibility of having our family complete. This is more than what we ever dreamed of. We thought we'd be doing really well with one baby.
Have it start, everyone, yeah? So big stretch there, Jenny, okay?
Yeah.
Big stretch, yeah. Okay, then. Okay, 100%. That's it. Well done.
Yes, we have. Congratulations, guys. Little baby boy again. There you go. Waving at you.
When I heard him crying, it was just brilliant. He's here.
3.45 kilos.
He's down there, like that. Just kind of no words, you know. Sense of peace, sense of happiness, like. Just can't wait to hold him again.
Oh, no.
Everything's perfect with him now.
He's gorgeous. You are just gorgeous, look at you. Oh, it's just unbelievable. There's no feeling like it.
It just feels like our family unit is complete. It's like winning the lotto to us.